Good morning. This is Aslam Khan, Professor of Index Nursing College. Today we are reading about topic that is leukemia. First we'll see the definition of leukemia. Leukemia is a general malignant disorder affecting the blood and blood forming tissues of the bone marrow, limb system and spleen. This is the definition of leukemia. We will see the etiology and pathophysiology. There is no single causative agent in the development of leukemia. Most leukemia result from a combination of factors including genetic and environment influences. It also includes chemotherapeutic agents, alkylating agents, viruses, radiation, and immunologic deficiency have all been associated with the development of leukemia in the susceptible host. There is an increased incidence of leukemia in radiologists. If we see the classification of leukemia, this classification of leukemia is based on the acute versus chronic and the type of WBC involved. The term acute and chronic refers to cell maturity and nature of disease onset. Acute leukemia is characterized by the clonal proliferation of immature So, if you see, the acute leukemia is characterized by the clonal proliferation of immature hematopoietic cells. Chronic leukemias involve mature forms of the WBC and the disease onset is more gradual. So, based on this, leukemia is classified in four categories, that is acute myelogenous leukemia, acute lymphocytic leukemia, chronic leukemia, and chronic lymphocytic leukemia. These are the four types category of leukemia. So these are the four types forms of leukemia: acute myelogenous leukemia, acute lymphocytic leukemia, chronic myelogenous leukemia, and chronic lymphocytic leukemia. If we see the acute myelogenous leukemia, age of onset usually it is an increase in incidence with advancing age. Peak incidence between 60 to 70 years of age. If we see the clinical manifestation of acute myelogenous leukemia, fatigue and weakness, headache, mouth sores, anemia, bleeding, fever, infection, sternal tenderness, gingival hyperplasia, minimal hepatosplenomegaly, and lymphadenopathy. This is the clinical manifestation of acute myelogenous leukemia. Usually, acute myelogenous leukemia represents only one-fourth of leukemia, but it makes up approximately 85% of the acute leukemia in the adult. The onset is often abrupt and dramatic. A patient may have serious infections and abnormal bleeding from the onset of disease. Second classification is acute lymphocytic leukemia. This is the most common type of leukemia in children and nearly 50% of acute leukemia in adults. In acute lymphocytic leukemia, immature lymphocyte proliferates in the bone marrow. Most are of B cell origin. Fever is present in the majority of patients at the time of diagnosis. Signs and symptoms may appear abruptly. Third one is Chronic myelogenous leukemia. Chronic myelogenous leukemia is caused by excessive development of mature neoplastic granulocytes in the bone marrow. The excess neoplastic granulocytes move into the peripheral blood in massive numbers and ultimately infiltrate the liver and spleen. These cells contain a distinct cytogenic abnormality, the Philadelphia chromosome, which serve as a disease marker and result from translocation of genetic material between chromosome 9 and 22. Third type is chronic myelogenous leukemia. So, chronic myelogenous leukemia is the most common leukemia in adult. It is characterized by the production and accumulation of functionally inactive but long-lived small mature appearing lymphocyte. The type of lymphocyte involved is usually the B cells. So these are the four forms of, we can say, type of leukemia. If we see the one by one the clinical manifestation. So first one is clinical manifestation of acute myelogenous leukemia. The clinical manifestation include fatigue and weakness, headache, mouth sores, anemia, bleeding fever, infection, sternal tenderness, gingival hyperplasia, minimal hepatosplenomegaly, and lymphadenopathy. These are the clinical manifestation of acute myelogenous leukemia. Second type is the manifestation of acute lymphocytic leukemia. The clinical manifestation include fever, pallor, bleeding, anorexia, fatigue, and weakness. Weakness of the bones, joint, and abdominal pain. Generalized lymphadenopathy, infections, weight loss, hepatosplenomegaly, headache, mouth sores. Neurological manifestations include CNS involvement. It increases intracranial pressure. There is nausea, vomiting, lethargy, cranial nerve dysfunction, secondary to meningeal infiltration. Third type is chronic myelogenous leukemia. The manifestations are, in the earlier there is no symptoms in this disease, but later on fatigue and weakness, fever, sternal tenderness, weight loss, joint pain, massive splenomegaly, and increase in sweating. Fourth one is chronic lymphocytic leukemia. The manifestation include, in the beginning there is no sign and symptoms, but later after detection of disease, often during examination of unrelated condition, there is chronic fatigue, anorexia, splenomegaly, lymphadenopathy, hepatomegaly. It results in fever, night sweats, weight loss, fatigue, and frequent infections. These are the clinical manifestations of chronic lymphocytic leukemia. Next, we'll go for diagnostic studies. Diagnostic studies mainly target on peripheral blood evaluation and bone marrow examination. Diagnostic studies also involve the type of leukemia. In case of acute myelogenous leukemia, diagnostic findings are low RBC count, low HB, low HCT, low platelet count, low to high WBC count with myeloblast, high LDH, greatly hepatocellular bone marrow, and myeloblast. If it is case of acute lymphocytic leukemia, diagnostic findings include low RBC count, HB, low platelet count, low normal or high WBC, hepatocellular bone with lymphoblast. Lymphoblast also possible in cerebrospinal fluids. Presence of Philadelphia chromosome in case of 20 to 25% of patients. If it is chronic myelogenous leukemia, the diagnostic findings include low RBC count, low HB, HCT, high platelet count at the earlier, lower count of platelet in the later condition of the disease, increase in polymorphonuclear neutrophils, normal number of lymphocytes, and normal or low number of monocytes in WBC. There is low leukocyte alkaline phosphate, presence of Philadelphia chromosome in 90% of patients. Next type is chronic lymphocyte leukemia. The diagnostic finding include patient is having mild anemia and thrombocytopenia with disease progress. Total WBC count will be more than 1 lakh. Increase in peripheral lymphocytes, increase in the presence of lymphocytes in the bone marrow. Hypogammaglobulins may have autoimmune hemolytic anemia in the case of 4 to 11%. Idiopathic thrombocytic purpura in 2 to 4% of cases. So this is the diagnostic findings, mainly evaluation of peripheral blood and bone marrow examinations. If you go for the management is mainly based on drug therapy, hematopoietic stem cell transplantation. So therapeutic agent used to treat leukemia are various drugs which is used for leukemia. It include alkylating agents, antitumor antibiotics, antimetabolics, corticosteroid, nitrosoureasa, myostatic inhibitors, biological target therapy, podophytotoxin, retinoid, and miscellaneous. These all include the drug therapy. In drug classification of alkylating agents, drugs will mostly give that is busulfan, chlorambucil, cyclophosphamide. These are the alkylating agents. Antitumor antibiotics, anthracylin, daunorubicin, doxorubicin, mitoxanton, idarubicin. These are the antitumor antibiotics. Antimetabolites will give cytarabine, 6-mercaptopurine, methotrexate, 6-thioguanine, fludarabine, nedarabine. Corticosteroid include prednisone, dexamethasone. Nitrosoureas include carmustine. Mitotic inhibitor vinca alkaloids include vincristine, vinblastine. Biologic target therapy include rituximab, alemtuzumab, gemtumab, ozogamicin, and imatinib. Photophyllotoxin include etoposide, retinoid include tretinoin. Miscellaneous drugs include S. arbutinus, picasparagus, hydroxyurea, and arsenic trinoxide and phantostatis. These are the drug therapy which we use for leukemia. If we'll go for hematopoietic stem cell, the condition is different here. So, hematopoietic stem cell transplantation is another type of therapy used to patient with different forms of leukemia. The goal of hematopoietic stem cell transplantation is to totally eliminate leukemia cell from the body using combination of chemotherapy with or without total body irradiation. This treatment also eradicate the patient hematopoietic stem cell, which are then replaced with those of an HLA male sibling or voluntary donor, an identical thing or the patient own analogous stem cell that were removed before the intensive therapy. The primary complications of patient with allogeneic HSCT are graft versus host disease, relapse of leukemia, all infections, especially interstitial pneumonia. So this is about the hematopoietic stem cell transplantation. Next, we'll talk about the nursing management. Nursing management is very important. Patient required lot of care. So, in nursing assessment of leukemia include subjective data, that important health information, which include past health history, exposure to chemical toxin like benzene, arsenic, exposure to radiation or virus like Epstein-Barr virus, HTV1, history of any chromosomal abnormalities like Down syndrome, Klinefelter syndrome, Fanconi syndrome, immunological deficiency like immunological deficiency patient may have in past, or patient had any organ transplantation. There is history of frequent infections, any bleeding tendency, medications use of phenylbutane, chloramphenicol, chemotherapy, surgery or the treatment like radiation exposure, radiation and chemotherapy for cancers. So data also include functional health pattern, health perception, health management, family history of any leukemia, malaria, nutritional metabolic history is also very important. Patient is having any mouth sores or history of any weight loss. Patient had any chills, night sweat, nausea, vomiting, anorexia, dysphagia, early safety, and early bruising. In elimination, we will ask for hematuria, any decreased urinary output, diarrhea, dark or bloody stool. Regarding activity and exercise, patient is having fatigue with progressive weakness, dyspnea, epistaxis, cough, cognitive perceptual, patient is having headache, muscle cramp, sore throat, generalized sternal tenderness of bones, joints, and abdominal pain. Paresthesia, numbness, tingling sensation, or any visual disturbance. In sexuality, reproduction, patient is having history of any prolonged menses, menorrhagia, impotence. So we'll check for objective data. In general, we'll check for fever, generalized lymphadenopathy, and lethargy. In integumentary system, check for pillar or jaundice. If there is any petechia, ecchymosis, purpura, reddish browny to purple cutaneous infiltrates, macules, and papules. We'll check in integumentary system. In cardiovascular, we'll check for tachycardia and systolic murmurs. In gastrointestinal, we'll check for gingival bleeding and hyperplasia. If there is an olar ulceration, herpes and candida infections, perirectal irritation and infection, any hepatomegaly or splenomegaly. In neurological data, there is history of any seizure, disorientation, any confusion, decreased coordination, any cranial nerve palsies or papilledema. In musculoskeletal system, we'll check for muscle wasting, bone pain, and joint pain. So, possible findings will be low or normal or high WBC count with shift to the left, increase because of increased blast cell, anemia due to hematocrit and hemoglobin, decrease in hematocrit and hemoglobin, thrombocytopenia, presence of Philadelphia chromosomes, hepatocellular bone aspirate of biopsy with myeloblasts, lymphoblasts, and markedly decreased normal cells. So this is about the leukemia definition, its causes, pathophysiology, its incidence, clinical manifestation based on the types of leukemia that is divided into acute and chronic leukemia, acute myelogenous leukemia, chronic myelogenous leukemia, acute lymphocytic leukemia, chronic lymphocytic leukemia, based on classification and types, clinical manifestation, diagnostic studies, that is mainly peripheral blood examination and bone marrow examination. Management include drug therapy, which enlist a variety of drugs, alkylating agents, anti-tumor antibiotics, anti-metabolites, corticosteroid, nitrosoureas, mitotic inhibitors, biological targeted therapy, photophytotoxin, retinoid, and there are variety of miscellaneous drugs which used for leukemia. Apart from this, management include hematopoietic stem cell transplantation, and of course, very important nursing assessment, which include subjective and objective data. Thank you.